Alice, asset limited, income constrained employed, the rate in Beaver County is going up, and it's going up more on the actual Alice population than poverty population. And since 2010, the number of Alice households in Pennsylvania have increased exponentially above the number in poverty. It is going to continue to increase. The Alice population this year is doing without $15,000 per household that they had in 2021 because of all of the income tax credits. And people are saying, oh, well, wages are going up. So with the wages increasing, the problem is that the prices are increasing more. Yes. So it's not helping that situation. But I'm wondering if in homelessness, you're going to see more of a rise out of that Alice population, because Alice doesn't know how to be in poverty. They're used to having their own home, having a job, being able to feed their families and doing all of this.
Well, we see that when we talk about the men at specifically the men at our shelter, where a high percentage of them are employed.
Yes.
But they can't, but they're still, when people say, well, get a job or do X, Y, or Z, many of these men are working. They're leaving for work during the day, but they can't afford the rents. They can't afford all the things that you're talking about. They're in that predicament.
Yes.
I think people are surprised to hear that.
Well, and I just had a family that we were trying to help this past week. The man has a good job. They have 3 or 4 kids. Like some kids, the one ended up with pneumonia and was in the hospital. And then another one actually got hit by a car in a shopping cart in a parking lot. And she had a concussion. Now she has PTSD, and so now she has to have some mental health treatments. And they got behind on their light bill, their electric bill. Both husband and wife separately said to me, if we could just get this bill paid off, we'd be fine. We just don't have the money to get this bill paid off, and now they're going to shut our electric off, and we don't know what to do. And so with electric being shut off, then you have an unsafe environment, and there starts the snowball, right? And that's why I'm saying this family is absolutely Alice. Absolutely.
And they could, I hope they don't, but they could end up in our door.
Absolutely.
And you mentioned something with health concerns. Mm-hmm. I've experienced this in my own life. You're plodding along in your day-to-day life, and one day you're diagnosed with cancer.
Right.
And that's not a cheap. I was fortunate. I had insurance, but there are people who don't. We had individuals come through our process. We've housed people at the end of their lives, younger people who are going through that sort of challenge and trying to navigate that with the stress of housing and everything. So when people ask, well, what does the typical person who comes to your door look like? I can't tell you that because they look, it's everybody. I say, look in the mirror, look to the left, look to the right. It could be any of us. Move it. People say, well, this happened or that happened, that they were responsible for that. Any one of us, our lives could turn on a dime with a medical challenge like that, or other things. And so that's why this job is challenging. It's not easy to paint the profile because it could touch each and any one of us. And there are limitations. We're providers, and we're doing the best that we can, but there are limitations. We're appreciative to reach across county and learn from one another and support one another. But this is a real issue in our community. And that's why this dialogue is so important to be able to have, and what the United Way is doing, and what the Chamber is doing, and what others around this table, faith-based community and others, are doing. So that's why it's been such a great opportunity to have you all around the table and have this conversation.